Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thank you for joining us. Today on Community Health Heroes, we'll be talking about three very important health issues that affect our community: chronic kidney disease, its treatment and prevention, the causes and treatment of asthma, which approximately 200,000 Louisiana adults suffer from, and now that it's spring, the weather is getting nicer, we'll be talking about heart health, as the newest American Heart Association walking path is to be officially dedicated on May 2nd at Palmer Park in Uptown New Orleans. Today's guests on Community Health Heroes include Tori Kranz, CEO of the National Kidney Foundation of Louisiana, who will talk about the organization's activities and its free screening programs. Dr. Kyle Happel, Associate Professor of Medicine, Pulmonary and Critical Care Medicine section at LSU Health Service Center, who will talk about asthma, its treatment and prevention. And Jenny Daniels of the American Heart Association, who will talk about the newest United Healthcare sponsored walking path at Palmer Park in Uptown New Orleans, which will help people improve their heart health and get overall better shape for the upcoming summer months. We have lots of great information to share with you, so don't go away.
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards.
Oh, don't. Oh,
It went into Bob and Carol's yard. Oh, no? Okay, here it comes.
oh Mom!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you.
Let's go.
Search We Can for more ideas on how you and your kids can get healthy together.
Quiet, please. Wait a sec. I'll take one. Oh, yeah. All right. All good. Take care. Way to go. Nice. Bring it on. Gotcha. I'm here for you. Oh, no. Please, please, please. I'm waiting. Interesting. Not buying it. Not fair. That's it. This conversation is over. Oh, brother.
Body language can tell you all sorts of things.
I'm having a stroke. I'm having a stroke.
Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment, and that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
Did you know that 1 in 9 American adults have chronic kidney disease? That is 26 million Americans, and 10% don't even know it. Joining us today to give us an update on the good works the National Kidney Foundation is doing in our area and what you can do to better your kidney health is Tori Kranz, Chief Executive Officer of the National Kidney Foundation of Louisiana. Thank you for joining us today, Tori.
Thank you for having me, Dr. Walker.
Can you tell me a little bit about what our Americans and Louisiana citizens can do to help protect their kidney health?
Sure. First of all, high blood pressure and diabetes are the main causes of kidney disease. And here in Louisiana, we rank in the top 5 of the population that have those diseases. So it's really important to talk to your doctor about your kidney health and how keeping your high blood pressure under control and your diabetes under control can stop the progression of chronic kidney disease.
So how often should a patient go and see their doctor if they have high blood pressure or diabetes?
First of all, it's important that you bring up the conversation with your doctor. At the National Kidney Foundation, we educate primary care physicians, nurse practitioners, and other allied health professionals so they'll know about kidney disease. So go to your doctor once a year during your checkup and just ask them to do a simple test to measure your kidney function. It's called an EGFR, and they can also test for protein in your urine.
So those are 2 easy tests that can help.
Very easy tests.
Okay. And then we were talking before the show about Louisiana statistics and national statistics. How bad is the problem with kidney disease in Louisiana or the nation?
In Louisiana, we have over 8,700 patients currently on dialysis, another 426,000 that are living with chronic kidney disease. So part of our program is we will test those people and then give them a clinical action plan that they can take to their doctor to make sure that their kidney disease doesn't progress so they have to go on dialysis. So those are some staggering numbers.
Very, very large numbers. And what about if you did progress to kidney failure? How long would it take to wait for a transplant if you needed a transplant?
In Louisiana, the wait time is approximately 3 to 5 years, but what we encourage doctors to do is to talk to their patients about early transplantation to better their quality of life so they don't have to go on dialysis. So if you find out that you do have end-stage renal disease, talk to your physician about that option too. Go to your friends, go to your neighbors, and tell them that you'd like an early transplant. Spread your net wide so you can find a compatible donor.
Okay. And then you have some upcoming events that sound pretty exciting.
We do. One of the things that we offer in the community, and it's sponsored by the Walmart Foundation, is our Kidney Early Evaluation Program. And that's a free community-based screening for people who are at risk for kidney disease, people who have high blood pressure, people who have diabetes, or family history. Our next screening is going to be on April 20th in Marrero at St. Joseph the Worker Church, and people can call our office for more information.
Okay, and if we wanted to find more information, do you have a website that you'd like to share with us?
We do. Our website's great. It has a lot of resources. It's www.kidneyla.org.
So kidneyla.org?
Mm-hmm.
That's wonderful. Any other upcoming fundraisers or sponsorships that you'd like to discuss?
We have a great event. It's our Gift of Life Gala, in which we celebrate a community hero that is given back to the Kidney Foundation, and that's going to be June 9th at the New Orleans Marriott Convention Center. And we have 15 celebrity chefs participating, and the public is definitely invited. Tickets are $100 each, and they can call our office for more information.
So that's right, coming up too.
Yeah, that's right, coming up, and we're actually honoring a local doctor, Eric Simon.
Tori, can you tell me what somebody could do if they are interested in donating a
Sure.
kidney?
April is actually Donate Life Month, so we encourage everyone to go to the DMV, and they can go online too, and to make sure that they check the box to be an organ donor. But what is most important is that you tell your family and friends about your wishes, because at the time of your passing, they could override that.
Okay, that's very good information. So April is Donate
April
Life
is
Month.
Donate Life Month, so go ahead, be an organ donor, and check that off when you go to the DMV.
Tori, can you tell me if there's some other upcoming events?
Sure, we have a fundraiser coming up on Sunday, June 9th. It's our Gift of Life Gala. We have over 15 celebrity chefs participating, and it's a chance for us to honor someone in the community that's given back to the Kidney Foundation. This year we are honoring Dr. Eric Simon, and we invite the public to the event, and they can get tickets by calling our office.
Very good. Is there anything like lifestyle or healthy choices that somebody should make to also help prevent them from going on the path of kidney disease?
Again, keep your high blood pressure in check. Exercise regularly. Take your medications as you normally would. If you have diabetes, make sure that you're following a healthy diet. It's all those healthy lifestyle choices that we all should be doing, and sometimes we're just not as compliant as we should be.
Well, Tori, this has been extremely valuable information since Louisiana is at risk for developing kidney disease with a high amount of patients that have diabetes and high blood pressure, and I really appreciate you taking the time to share this information with us.
Good, thank you. Well, if anybody needs more information, again, they can go to our website at kidneyla.org.
Thank you, Tori.
Thank you.
We really appreciate you sharing this valuable information with our community. Stay tuned for more Community Health Heroes.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
In 1977, in Johannesburg, South Africa, an 8-year-old boy picked up the game of golf from his father. By the age of 9, he was already outplaying him. The odds of this gentle lad winning the Junior World Golf Championships at the age of 14, 1 in 16 million. The odds of that same boy then making it to the US and European Pro Golf Tours, 1 in 7 million. The odds of the Big Easy winning the Open Championship once and the US Open Championship twice, 1 in 780 million. The odds of this professional golfer having a child diagnosed with autism, 1 in 88. Ernie Els encourages you to learn more at autismspeaks.org/signs. Early diagnosis can make a lifetime of difference.
Packers. Viking. Packers. Viking. Packers.
Red state, blue state, vegan,
Carnivore.
We come from different places.
Uptown.
downtown,
Night owl.
Early
We
bird.
come to different conclusions.
Half empty.
half full.
But when we live united, we create real, lasting change in the building blocks of life. The education, income, and health of our communities,
Live.
our families,
United.
even the person next to us.
Live united.
Real change won't happen without you. So give, advocate, volunteer, live united. Sign up at liveunited.org.
2 outs with a runner on first base. Now the big guy comes up to bat, hitting .342 with 92 RBIs and 36 homers. Number 50,000 is back
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Many people in New Orleans and throughout Louisiana seem to either suffer from asthma or know someone who suffers from asthma. Presently, 200,000 adults in Louisiana suffer from asthma, and 1 in 10 Louisiana households with children have at least one child with asthma. Joining us today to talk about the latest treatments of asthma and the asthma research currently being conducted is Dr. Kyle Happel, Professor of Pulmonary Medicine at LSU Health Services. Welcome to our show.
Thank you, Penny.
So asthma is pretty darn common, it looks like.
It's a pretty common disease. It's actually getting more common as time goes on.
And what are some of the factors you think that are contributing to that?
Sure. So we know a lot about asthma is due to an aberrant immune response that children have to their surroundings and their environment. So a lot of times allergies have a lot to do with asthma, allergies to pollen, allergies to grasses, things like that. We also have adults that have asthma due to a lot of times allergies, but sometimes due to things that we don't quite understand. So it really is sort of broken up into a pediatric disease with kids and an adult disease that seem to be similar but different.
And what can you do if you know you have asthma to prevent an asthma attack or trigger your asthma?
So certainly the best thing to do for asthma is to take your medications as they're prescribed. If you're seeing a physician, either a primary care doctor or an allergist or a pulmonologist like myself, it's very important to take those medicines as you are prescribed. It's also very important to avoid any situations or exposures that are likely to precipitate an exacerbation. A lot of times, particularly this time of year, we have a lot of pollens in the air, a lot of tree and grasses are pollinating. Smoke is actually a huge problem for asthmatics. They will have a non-specific response to just smoking, and that just by itself being around it from other people can affect an asthma attack.
So not just the patient smoking, but somebody in the household smoking?
Absolutely. Yeah, there's a lot of problems with environmental exposure to tobacco causing asthma attacks.
Dr. Happel, we were talking about smoking and the risk factors even to secondhand smoke. But what if somebody, I know a lot of parents like to do this, they go outside, they have their cigarette, and they come back in and they have an asthmatic child. Is that also risky?
It can be. Certainly if the person smells enough of smoke and the person who has asthma is close enough to them, that odor is just enough to kick off asthma attacks sometimes.
And I think our community also, I get asked questions, can you really develop asthma as
Absolutely.
an adult?
There is a very well-recognized subtype of asthma that's adult onset. We'd love to know more about why some people get it as adults versus children, which is what usually happens. Sometimes, in fact, adult onset asthma can be more difficult to manage than even childhood onset asthma.
Is it because it's a more aggressive
It is a little bit
disease?
different, it really is, and sometimes it does not respond to medications like childhood asthma does. And unlike childhood asthma, the natural history of which is you kind of grow out of it as you get older, sometimes people will have adult onset asthma for a very long time.
Dr. Happel, what's one of the biggest things you see that patients aren't doing that they could improve upon?
That's a great question, Penny. So one of the big features of asthma is it's a disease of exacerbations and remissions. Sometimes you feel great, sometimes you feel bad. It's very easy to remember to take your asthma controller medications when you're feeling poorly, and it's easy to understand why you're taking them. When you're feeling well, sometimes patients forget or just don't feel like they need to take the medications when they're not doing poorly. So the message there is it's very important to take your asthma medications as they're prescribed, both when you're feeling well and when you're not feeling well. Otherwise, the asthma medications won't have the opportunity to work as they're supposed to.
That's very good information. And then what about people that travel? What's one of the biggest factors that you're seeing when somebody travels?
Absolutely. Sometimes when people travel, they remember to bring all of their clothing and their cameras, but not their asthma medications. And it's very important to bring all their medications if they're using a nebulizer machine to pack that as well as any supplies. And to remember that if they're going somewhere and they do forget their asthma medications, they can always call their physician. Even if they're out of state, we can always call it in for the patients if there's a pharmacy nearby for them.
Good. And there's some new research and information out about vaccinations. Can you tell me a little bit about that?
Yeah, actually there are recommendations now from many governmental agencies that it's important for all asthmatic patients to get both the pneumonia vaccine as well as the annual influenza vaccine. So get your flu shot every year, and the one-time pneumonia shot is also very important for all of our asthmatic patients.
Well, great, Dr. Happel. I really appreciate this information. Thank you so much.
My pleasure.
And you started to hint about some research. You'd like to know more information about these adult onset asthmatics. So what kind of research are you currently involved in?
Yeah, so we're part of the American Lung Association's Asthma Clinical Research Group. And as one of 18 centers across the country that's doing asthma research, we are doing these large clinical trials asking different questions about asthma. How best to treat it, how to prevent it, how to educate patients best about it. So we've got several trials currently ongoing.
And if I want to know more, our community want to know more about asthma, what kind of websites or information is available to us?
Absolutely. Probably the best thing that they could do is visit the American Lung Association's website, or if they would like more information about perhaps participating in a clinical trial, there's a telephone number that they can call. If it's here locally, the area code is 504-568-3450, and we can speak with them about perhaps participating in a trial.
So they can either go to the American Lung Association's website or maybe even LSU's website?
Absolutely.
Okay, or call your number.
Absolutely.
Well, this has been incredible information for our community. We know we have a lot of asthmatics in our population, so thank you so much for taking the time to share this information with us.
My pleasure.
The month of May is officially designated as the National Asthma and Allergy Awareness Month. If you think you or a loved one might be suffering from allergies or asthma, we encourage you to visit your doctor as soon as you can. And we'll be right back with more Community Health Heroes.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
For those dealing with the daily struggles of caring for a loved one, we hear you. That's why AARP created a community with experts and other caregivers to help us better care for ourselves and the ones we love.
The odds of this daughter of a clergyman spending 11 weeks at #1 on the U.S. singles charts? 1 in 19 million. The odds of going on to win 6 Grammy Awards? 1 in 1.4 million. The odds of having a child diagnosed with autism? 1 in 88. I'm Toni Braxton, and I encourage you to learn more at autismspeaks.org/signs.
Last May, as part of its 3-year, $1.95 million commitment to the American Heart Association, United Healthcare helped establish the first American Heart Association designated walking path in Duncan Plaza across from New Orleans City Hall. A second walking path will be dedicated on May 2nd at 10:30 a.m., located in Palmer Park at the corners of Carrollton and South Claiborne Avenues. This newest walking path will prove to be another excellent way for area residents to walk their way to better health. Joining us today is Jenny Daniels, Heart Walk Director for the American Heart Association of Southeast Louisiana. Thank you for joining us today, Jenny.
Thank you for having me today.
So what kind of impact can we have if we walk more on our heart health?
Well, walking is one of the easiest forms of exercise, and it also has the lowest dropout rate. And they recently did some research that showed that walking is just as good as more vigorous exercise, such as jogging. It can lower your bad cholesterol, raise your good cholesterol. It can also lower your blood pressure. It helps to relieve stress and also improve your mood, and it can prevent your risk for type 2 diabetes.
It's also another way to incorporate wellness into your lifestyle and maybe help lose some weight.
Definitely.
And then can you tell me some of the ways that you can improve your heart health, some examples of ways to improve your heart health?
Well, the AHA recommends a minimum of 30 minutes a day of moderate activity, and we think walking is the best way to do that. And some quick tips that you can incorporate walking. Consider parking in the furthest parking spot when you go to the office or when you go to the mall. Think about taking your dog for a walk, taking your kids for a walk. Maybe skip dessert in the evening and go for a walk. Other things you can do, maybe the weather's bad, go and walk at the mall and take a chance to do some window shopping and watch people. So that's one other area, especially I know as the summer months are coming, it's going to get a little bit hotter out. Be social, join maybe a team or do a group exercise class. So that's some things that you can do to incorporate exercise and activity into your daily life. And also something, 30 minutes sometimes can seem a little daunting. Maybe break those up into smaller sessions, maybe 3 10-minute sessions or 2 15-minute sessions.
So you don't have to do all 30 minutes all at once?
No, so you can really break that up and make it work for you in your daily life.
And what are the benefits of walking with a team or a group or joining an activity that's sponsored with a bunch of people?
Well, it really helps motivate you and also keeps you going. So a lot of times you're just like, oh, I don't have time for that. But if you're doing it with a group, then you'll be more willing to keep up with it and make it an actual habit.
And do you have any upcoming events that the American Heart Association is sponsoring?
Well, like you mentioned, we're kicking off the second official walking path at Palmer Park. We also have our gala coming up on May 11th and our New Orleans Heart Walk, which is November 2nd.
And so if I can't remember all those dates, where would I go for more information?
You can go to heart.org or you can follow us on Facebook, so facebook.com/AHA New Orleans, or you can follow us on Twitter at twitter.com/heartaha. Oh. Sorry. Twitter.com/heartnola.
Jenny, that's a lot of dates. Where would I go for more information if I wanted to check on what American Heart Association has planned?
Well, you can visit our website at heart.org, or you can like us on Facebook, facebook.com/AHA New Orleans, or you can follow us on Twitter, twitter.com/heartnola. And also you could email me at GNO New Orleans Heart Walk at heart.org.
And I have another question. We see a lot of people wearing pedometers in the park now. What are the benefits of wearing a pedometer?
It really helps you track what you're actually doing, and you get more of a accomplishment or sense of accomplishment, so that you can see after the whole day's over, oh my gosh, I've just walked 7,000 steps, and it lets you really translate that into your daily life and what you're actually accomplishing.
And what about incorporating the pedometer with your group?
Well, we do have a startwalkingnow.org program online where you can visit and track your steps that you're doing. So that's something that you can go in and keep track of them. And if you're doing it with a group, you can also have them sign up online as well.
And maybe even challenge each other?
Yes, it creates a little bit of a competition where you can try and see who gets the most steps.
So Jenny, how big of a problem is heart disease in Louisiana?
Well, heart disease is our #1 killer. It claims more lives than the next 3 leading causes of death combined, including cancer. In Louisiana specifically, about 10,000 people a year die from cardiovascular disease. So it's something that's really impacting a lot of people. And it's also kind of a silent killer. A lot of people don't realize that they have heart disease until it's too late.
And the prevalence in men is much more than women?
Actually, it's more prevalent in women. So that's something that a lot of people don't realize as well. So,
thank you, Jenny, for joining us today and providing this valuable information. And we look forward to seeing many more walking paths and walkers in the near future. Stay tuned for more Community Health Heroes.
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him opening his own clothing store at the age of 18? 1 in 138,000. Excited to be a part of pop culture, he packed for the big city. The odds of finding someone to invest in his vision? 1 in 4.5 million. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs. Early diagnosis can make a lifetime of difference.
NFC, AFC, offensive linemen, defensive tackles, quarterbacks, and cornerbacks are all working with United Way for a million little reasons. The kids of our communities, to ensure their academic success all the way to graduation day. You see, it takes about 12 years to create a graduate, but it takes the same time to create a dropout. And the difference between a kid becoming one or the other could be a professional athlete, or it could be you. Studies showed the earlier we get to kids, the better their chances. So become a United Way volunteer reader, tutor, or mentor, and make a difference in the life of a child, for the life of that child. Give.
Advocate.
Volunteer. Live United. Join your favorite NFL players. Take the pledge. Go to unitedway.org.
The odds of becoming a successful NASCAR driver? 1 in 125 billion. The odds of a child being diagnosed with autism? 1 in 88. I'm Jamie McMurray. Learn more at autismspeaks.org/signs.
Thank you once again for joining us. We hope that the information we provided today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.